Okay, so Zika, whatever happened to Zika virus? Remember Zika was like, everybody was talking about it, it was like this big panic, and so I looked it up on the CDC site. So right now they're not showing, at least on the CDC site, that there's any like outbreak. So like Zika hasn't gone away. So what's really happened to it? So I think when it was like a novel virus, it was spreading like crazy. But what we'll see in the subsequent slides is that once you get Zika, you're immune. So I kind of suspect that a lot of people got Zika, and it's just not circulating as much as it was before. But you can see here, like the purple is there's some current or past transmission in that country, but there's no current outbreak. The yellow is like the mosquito is present, but they haven't reported any cases. I mean, some of these places are poor that they don't report, but they can't say that it's definitely there. And then the green is there's nothing there. If you look at the light purple, it's interesting. The elevation is high enough there where, for whatever reason, I guess the mosquitoes don't fly that high or something like that. That's what they literally said that on the website. I thought that was kind of interesting. That because of the elevation, they thought that it wasn't really a risk. So microcephaly was the big thing. So all these awful cases where women were being infected with Zika, and the babies were getting either stillborn or dying shortly after birth, or having these horrible birth defects. Most of the time, though, this is an asymptomatic or a mild infection. Fever, headache, joint pain, red eyes, muscle pain, and again, infection usually confers immunity. Sometimes Guillain-Barré as well with this particular infection, but there's no vaccine, there's no treatment. This can be sexually transmitted, so that was one of the things that was like, just really kind of problematic in terms of recommending to people what to do. And it's like, yeah, you don't have sex for 3 months. It's like, yeah, you get little lines with that. Yeah, it stays apparently, in the semen for months. So it is somewhat problematic, but it doesn't seem like it's as epidemic as it was, at least in certain areas, right now. Okay, so the West Nile virus is really seen throughout the continental United States. 1 in 5 persons infected are symptomatic. So, 4 in 5 are not, so a number of us could have had West Nile and never even have known it. And if we were symptomatic, maybe one of us got it and we just felt lousy for a few days and we didn't really know that either. So I suspect that there's a lot more people getting West Nile than we even know about. So about 1 in 150 people who are infected get serious illness, which actually can be fatal. And it's encephalitis or meningitis. And it's the typical thing. It's your older people, if they have a lot of medical comorbidities or they're immunocompromised, it puts the patients at highest risk. And then 1 out of 10, if you get, so 1 in 50 develop serious illness, 1 out of 10 of those then are gonna die from West Nile virus. So it's not taking a huge toll, but it can be very serious. Again, no vaccine, no specific treatment. So dengue, we're going through like quick ones right now. So this one is really staggering when you think about it as well in terms of the scope. 3 billion people are in endemic areas. 400 million infections worldwide. 1 in 4 gets sick, actually, when they get infected. So 100 million people are ill, and then 22,000 die. So there's just such a large number of people getting infected that even though the case fatality ratio is low, it's 22,000, which is like staggering. So there's 4 different viruses, so you can actually get dengue 4 times with the 4 different types of viruses, but you will get immune from the particular strain. It's normally a mild illness for 2 to 7 days, but 1 in 20 will get, who are symptomatic will get severe illness, and that can be shock, internal bleeding, and death. The internal bleeding is really the thing. I mean, I had one case where a patient was sick, and we were worried about that, but I think they ended up turning out all right. And infants and pregnant women are at higher risk. Again, no specific treatment. There is a vaccine for dengue, but it's interesting, they started vaccinating people in the Philippines with this thing, and they found that if you never had dengue before, it actually would cause you to have more severe dengue if you actually got ill. So it was actually making the situation worse. Or they said, like, if you've had dengue, then it would actually help. in a recurrent infection. It's very odd. It was just interesting to read. So they really dialed down people getting this vaccine. Again, it was mostly in the Philippines where they were trialing it, and it was a kind of a scandal. Chikungunya, another mosquito-borne illness here. So again, very widespread. But for us in the Caribbean, fever, joint pain. The joint pain can persist for months. Really, very rarely fatal. But again, the joint pain can be really problematic. You're immune if you get infected, and then it's very similar to dengue and Zika if you see like when it actually in terms of the symptoms. So there's no vaccine or medication to treat it. And I think they're all on the same mosquito, these guys. Okay, and this is actually the last one. This is mosquito-borne encephalitis viruses in the United States. So this one is nasty, the Eastern equine encephalitis, and thankfully it's very rare. But it's a third of the patients who get this die, and there's no vaccine or treatment. And then those who survive are like disabled with like either chronic seizure disorder or personality disorders or severe cognitive impairment. So it's really, really nasty thing. There's two presentations. There's like a systemic presentation, which isn't maybe quite as bad, and people can recover there's no neurological manifestations. But the encephalitic presentation, again, is just really nasty and can lead, even if someone survives, to severe disability. So that's in the United States, the Eastern equine. The St. Louis and the La Crosse are also, the St. Louis is a little worse than La Crosse. There's actually, I think, a case fatality ratio. There's like I think it was 5 to 15% of people die if they get that, if they're symptomatic with that. But often these are asymptomatic. But again, both of them can cause the severe neuroinvasive disease. But there's no vaccine or treatment for either one of these. So you kind of like someone comes in and they have encephalitis. They're confused. They maybe have a fever. You kind of lump those as an emergency physician all together, and like you're getting a spinal tap. You're admitting them, probably the ICU if they have a full-blown encephalitis, and then you're going to send it out, get infectious disease involved, and because you can't tell one from the other really. It's just they have encephalitis, and you got to test them for everything. First of all, you're worried about bacterial meningitis, and as soon as you kind of rule that out, then you're worried about what kind of viral meningitis is it, what kind of viral encephalitis. So these are some examples of what you can get if you have a case of encephalitis. And that's it. Thank you to Prince. Questions, anybody, or discussions?
When you say no vaccine or treatment, you mean treatment outside of
supportive care? Yeah. No specific treatment that like no antibiotic is going to get it, or so yeah. But supportive care is very, very important. In all these illnesses.
Fever, dehydration.
Yep. And ICU care, multi-organ failure or something like that. I mean, you just want to treat it. I mean, pressors, endotracheal intubation, all the ICU stuff that they do.
I have two. One is those other or illnesses that like you were talking about. Like, do they have tests for them? Like, is it similar like blood testing, or is it just?
They do. So anaplasmosis and ehrlichiosis, you can send antibody studies for.
Right, but those other ones like the Zika and that dengue and stuff.
Yeah, you can do PCRs for these things. Some of them are difficult to detect, but you can like dengue. You can do tests for dengue, blood tests for dengue.
Okay.
Yeah, but most of them there are tests for. In the you do the CSF
elimination or
right, and to varying degrees. I mean, it's all over the map in terms of the testing. But if there's one thing I would tell you guys is just clinical suspicion is the main thing. And the tick-borne diseases, you really the shift is now towards empiric treatment. Malaria is not empiric treatment. That's still trying to get a lab diagnosis, because you really have to know what species it is in order to know kind of how to treat it. So
my second question is, are they still doing that, like where if you pull off the tick and it's within that window, are you giving like just a one-time dose of 200 doxy and then they still do that?
So that was that slide where you know, it's gotta be an engorged tick on for greater than 36 hours, and then it should be an Ixodes. Again, I can't tell one from the other, so I just kinda say if it's an engorged tick and it's, you know, and they're not, you know, there's no contraindication to doxycycline, then, you know, I give it. For kids, you don't give the prophylaxis. It's just so they're under 8 and you don't give the prophylaxis. Teenagers, if a teenager came in with an engorged tick, you give them the doxy?
Probably.
Yeah? Yeah. I give them the doxy. I mean, it's probably not gonna hurt them anyway, but like, there's no data to support it being effective like in children, you know? So, I mean, and the data, to be honest with you, like we discussed, is kind of shaky in adults. Like, there's some debate about it, but like, you know, again, number needed to treat like, you know, 40 to prevent 1 case. It's a lot of doxycycline. You know? Good.
Are there any specific tests for if you've already been positive with Lyme's to see if you have an actual reoccurrence, or is that a reoccurrence is?
Yeah, that's a difficult thing because like, you know, the test can remain positive for a while. So like, you know, people come in and now they're having repeat symptoms and you test them again and now they're still positive. Well, is that just from the old, you know, previous infection, the immune response from that? And is it really a reinfection or not? So, you know, the thing is, like, if the shoe fits, just you would retreat, because again, you know, you can get Lyme again, early or early disseminated. You would certainly want to treat empirically. The testing is limited. I mean, it's a limited ability to help you. Certainly in early disease, because often it might be in negative. But just in general, these tests, you know, they don't come back right away. So, you know, if you want to get a jump on it, you start the therapy.
Anybody else? Thank you so much.
Thank you very much.